Great.
Yeah.
So I'm going to pose some questions to you that has been
Sure.
put into the system. One is I'm going to use the ones that are more related to the topic today first.
Mhm.
How do you solve the bouts of panic or anxiety feelings as they just come without any reason? And many times these feelings make our hearts pump faster and one starts to feel very fearful and anxious. So is meditation the only way to solve it?
It's not the only way. I mean, there's lots of different ways, but the way to do it mindfully, I mean, you're sort of almost there. So, can you separate the thoughts from the feeling? And so you think, oh my God, my heart's beating. It's like, okay, my heart's beating. I'm breathing fast. Okay. And so, can you just be aware of, okay, my heart's beating without like, oh my God, my heart's beating because, the minute you say my heart's beating because all the fear, right? So can you separate the thoughts from the physiology? And so it's like, okay, those, we know the fear is the danger is real, the fear is optional, right? And so, but so does the beating heart help us, right? So, back in the days of the saber-toothed tigers, we need to get our heart right beating fast so that we could run away from the tigers. But with COVID, there's nothing, you know, heart beating fast isn't going to do us any good unless we had to run. It's not going to do us any good. So it's an old response that's not useful. So can we just take a breath, relax, let go of the crazy thoughts, and try to just calm our body and just be aware of it without attaching significance to it? It's like, hey, my heart is beating, I'm breathing fast, can I breathe a little more slowly? And often that will help dissipate it.
Thank you.
Uh-huh.
And there's a question here, what would be a simple practice to help someone stay calm or focus in the moment? So Sarah's a meditator as well, so this question would
Yeah.
be right up your alley.
Right. So really just mindfulness practice. I mean, it's sort of like with sports. You need to go and you need to practice dribbling and kicking the ball so that in the game, you can just do it like this. So similarly, we spend 20, 30, 40 minutes a day practicing mindfulness so that in the game of life, we're ready and we'll just be mindful and it'll sort of kick in automatically. And so and like you can also like the anytime mindfulness, you can practice it, try to bring it to mind in those stressful situations. I know for me sometimes for driving in traffic, oof, I really, there's some days where it's like, okay, that's my practice today is I'm really gonna just try to be mindful the whole time. So it's like, okay, I'm gonna relax my shoulders now. I'm gonna stop growling at people, and that's a practice sometimes. Just over and over and over again.
Just bringing the mind back to the present.
Yeah,
Yeah.
yeah, yeah. And just when the thoughts go off and crazy, it's just like, okay, those are just crazy thoughts. I'm just gonna, what's real?
So coming back to the breath of the body. And
Yeah,
just
yeah,
thank you.
yeah.
Another question here is, how do we apply fear learning conditioning to reduce students' fear of tests and exams?
Yeah. Good question. Um, make them fun and easy.
Yeah.
Yeah, I mean, I think some of it is sort of, I think what Angie was getting at is like, we just like parents, the students, we have to teach them. We have to break that habit. And so we have to, so they hear exam, they think, oh my God, I have to get an A, right? I have to do well, I have to do perfectly. And so if you can say things to help them understand that, and obviously it's not going to be overnight because their entire lives they've been hearing, you must get perfect grades, you must get perfect grades, you must get perfect grades, right? I'm assuming. And so letting them know that, okay, I know that not everyone's going to get a perfect grade, and that's okay. Everyone is still going to get a good job.
Yeah.
There's a joke here in America. What do you call the guy who finishes last in his medical school class? Doctor.
Exactly.
Yeah,
Just make
it's
a
like you
difference,
don't.
right?
Exactly. And and it's sort of I was a child, and this was a hard one for me because I'm smart, and he's smart, but he just did not care. I could never ever ever get him to study. unless he was interested and excited. And if he just didn't care, he didn't care. And he just, he was fine getting B's. And so I had to learn to accept that and
Mm.
to realize, okay, he's not a straight A student. And, but then I also explained to him, it's like, okay, well then, there's gonna be certain things in your life you're not gonna be able to do, but if that's okay. But then we both realized that that's actually, so I don't think he would have done well at a high powered school, where everyone's always trying to study to get A. He's just much more laid back, and he's doing fine, and he's getting a job and the whole thing. And so, you don't have to be the top, right? There's, plenty of opportunities for people who are not right at the top. And, if you're not right at the top, well, then maybe this is not a good fit for you and you should find something else. I think that's here in the States, that's more and more understanding that. I mean, you look at who's making the most money, it's people like the sports figures and the, actors and musicians, the, pop music musicians. They're the ones who are wildly successful. They probably did horribly in school. And so, you don't have to get straight A's to be successful in life. The farmers, a lot of farmers are millionaires.
Yeah. But also
You know,
success is not just defined by how much money you have, because
right.
these famous people are onto drugs because they don't even know what happiness is, and they're surrounded by people whom they can't trust or have a real relationship with. So
Yeah,
being happy is being successful.
very much so. Yes, I agree with that 100%. Right. And because there's been many studies showing that there's no correlation between happiness and wealth.
Yeah.
I think up to a certain, at least $70,000 seems to be, there's a correlation. But after $70,000, there's absolutely no correlation between how much you make and your happiness.
Yeah.
So like, as long as your basic needs are met, after that, all bets are off.
Yeah, I'm much happier now earning less. So I'm always feeling like I've done the right thing, giving out money and have more
Exactly.
happiness every day.
Exactly. Because when you do what you love,
Yeah,
and that's important. That's really
thank
important.
you.
Mm-hmm.
So another question here is, I'm curious if there's a difference between practicing mindfulness short periods, like 15 minutes per day, versus practicing mindfulness for a long period, saying 8 hours a day. Wow. Okay.
Yeah.
What's your view on that?
So, yes. I like to think about a lot like exercise, right? So imagine if you, exercise for 5 minutes a day versus half an hour a day versus 8 hours a day. Obviously you're going to be in much better shape physically if you're exercising 8 hours a day, but you're also much more likely to get injured. And, it's not something, I don't think any of us would just go out and exercise for 8 hours, right? Or if we did, we'd be very, 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 very sore. It's something you want to work up to gradually. And, you should do it. You shouldn't just go out and just do that, right? You want to get some information about that, work with a trainer. So similarly with meditation, I mean, obviously there's monks who sit all day and practice all day. And I know I've been on week-long meditation retreats where I practice mindfulness for about 12 hours a day. But it's in a very, I go away, it's a quiet in the woods, and, you don't sit the whole time. You're doing walking mindfulness meditation. You're eating sometimes, and so it's not just sitting there like this for 8 hours. So, yes, 8 hours is beneficial, but I would not just start off and do that on your own. I'd definitely work up to it slowly and work with a teacher. If you're really going to do that level of mindfulness, you definitely need a teacher.
Thank you. Another question here is, based on studies, can one use mindfulness practice to overcome chronic anxiety completely without medication? What's your take on that?
It varies and it depends a lot. So I personally know some people who, after many years of practice, have been able to reduce, and some have been able to completely go off their medications. But I also know people who've been practicing 10, 15 years and they're still on their meds. Often it's much less medication than they were beforehand, but they often feel like there's still something going on that they need some medication. So I think it depends a lot on the person, the condition, exactly. There's a lot, I don't think it's a one size fits all.
Thank you. My 10-year-old son is impulsive and gets upset very easily. How can mindfulness help? We are new to mindfulness and not sure exactly what to do. Daily, about twice, I get him to sit down, turn on music, and get him to breathe in and out slowly. Is this considered practicing mindfulness?
Yeah, it's a start, definitely. Yeah. So there's lots of different types of meditation, and so one form of meditation is just to calm and focus, and then mindfulness is that little bit extra because it's this the equanimity and the non-judging, which is explicit to mindfulness. But all forms of meditation are good, and and even with mindfulness, it often starts with just that, with just focusing and calming the mind, and then gradually bringing the mindfulness, and sort of kind of develops naturally over time. But there's, if you sort of cultivate it specifically, you can do, but so getting him to notice his body, and maybe ask him before and after, listen to the music, say, okay, what does your body feel like right now? What does your mind feel like right now? What sort of thoughts are going through your head? And then have him listen to the quiet to the music, and then say, okay, what does your body feel like now? What are your thoughts like now? So he really starts to develop the awareness of what's going on for him right now, and how what he's doing changes how he feels, because that's where the mindfulness comes in.
Thank you. And I probably should mention that I can't see this, I think, but Dr. Christopher Willard will be featured again next week, and he's going to be speaking on building family resilience. So do look out for that. We'll be posting it up for you to register. And he does specialize on helping kids adopting and practicing mindfulness.
Yeah, he's literally written books on it, so it's he's great. Yeah.
Okay, another question here is, I suffered from spinal cord infra T5 to T7 with 24/7 nerve pain on my ribs in front and my back. I intend to do the next MBSR course. Meanwhile, I joined the Monday to Friday mindfulness sessions organized by Brahm Center. How do I minimize the nerve pain after mindfulness class? I would like to know more about practicing mindfulness, and should I consider taking medication?
Right. So, all right. So I'm not a clinician, so I can't give you clinical advice. Sorry about that. So there have been a couple of studies specifically with mindfulness for pain. And again, there's two components to pain. So one component, again, is the actual physical stabbing, and the other one is called pain catastrophizing. And that's the I don't like it, make it stop. Often, as you probably know, people with chronic pain, they avoid going out and doing things because they're afraid the pain is going to interfere and the pain's going to be too bad and too unbearable. And what the studies show is sometimes, I don't know if there's been shown, okay, this type of pain, it works, this type of pain, it doesn't. Sometimes there's actual reductions in pain, but what seems more consistent is the pain catastrophizing, right? And this sort of gets to what we saw in the scanner, in the MRI scanner, is that, the actual, the parts of the brain that light up to the actual physical sensation were actually turning on more, but it's that brown network, the I don't like it, make it stop, that's what was changing. And so that's kind of what's seen in the clinical studies as well, is that the actual pain levels may or may not change, but the relationship to the pain, you just people just say, like, it just doesn't bother me so much anymore, and so although it's still there, it's just they just have a completely new relationship to it. So yes, you may still want the pain meds depending on how bad it is. Yeah.
There's a cute question here. What you shared about exposure therapy will be applicable in the event that we have fear of visible items like lizards. What if the fear is more intangible, like criticisms and timelines? How do you overcome such fear?
Yeah. So, so then I would say, do it in your mind. So, I like to lie down, so get really comfortable, relaxed, feel safe, and then bring to mind that person who's criticizing you and the things that are like really, and instead of imploding and thinking, oh no, like as often criticisms, the reason why criticisms sting is because we believe them, right? And there's we think there's some bit of truth in them. So imagine that person saying it, and then instead of going, oh no, they're right, and oh no, I'm not good enough, or oh no, whatever, how you normally react, can you just breathe and relax and just hear those words without reacting with equanimity? It's like, okay, that's that person's opinion,
Mhm.
right? And maybe there is a kernel of truth. That's okay. That's how I am right now. But what's interesting is often by facing it and saying, yeah, okay, maybe I didn't do it perfectly, or oh yeah, maybe I'm not the fastest person, or whatever the criticism was. By accepting it, it loses its sting.
Mhm.
And so then you hear the criticism and it's just like, yeah, that's who I am. That's yeah. Or no, that's his opinion and that's not my truth. I don't see that to be the truth. And so you expose yourself to the criticism in a time when you're feeling safe, and you can then face up to it and just breathe and notice what's doing to your body and just let all that go.
Thank
So
you.
yeah.
I think people are generally fearful of other people's judgment, negative
Yeah.
judgment,
Yeah.
and so whenever we hear something negative, we we just believe it, or or we're just trying to reject it rather than just saying, okay, that's a criticism. Let me check if it's valid.
Yeah.
If it's valid, maybe I can use it to improve myself. When it's not valid, I just let it go.
Yeah.
So
Yeah.
when I organized a retreat, this was our slogan:
Ah.
I'm good enough.
Yes. I love that. I love that. I love that. I love that. That's great. Do you guys do self-compassion practice, metta
Yes,
practice?
yes, we do.
Excellent. So that's actually the other way I was going to say. That is like a wonderful antidote to criticism. Because basically, with the self-compassion, I mean, just telling yourself, may I be happy, may I be healthy, may I be safe, may I live with ease. Oh my God, that completely transformed me. For 6 months, that was my entire practice. I just did that every day. And that was just, it changed everything. I mean, it just undid so many old knots, so much old self-criticism. The thing is, often other people's criticisms lands because you had that criticism of yourself. So
Yeah,
stop criticizing yourself that way, and then it won't bother you when other people say it. So if you tell yourself, yeah, I'm good enough,
yeah,
i'm I'm perfect, I'm a little person, I love me,
yeah,
even if no one else loves me, I love me.
yeah.
Right, just be able to say those sorts of phrases. It feels like at first, but just keep doing it, and eventually something shifts and change, and you cry and you let it all go, and it just feels wonderful. And then, yeah, people say things and it's just like, yeah, whatever.
Yeah. Well, it's like
Yeah.
every tree in the forest, they're not completely straight, are they? And if they are, they're not beautiful.
Yeah.
So we are perfect like nature. We have our strengths and our weaknesses, our talents and our faults. And to be able to say, I'm good enough. And that way, if
Yeah.
anybody makes a criticism, say, yeah, okay, yeah, maybe that's valid. But this is the who I am.
Yeah. Yeah.
Yeah. Not in resignation, but in active acknowledgement. And perhaps I can change it. Not right now, but work in
Right.
progress.
That's the equanimity, right? So caring, so you're not indifferent, but caring non-judgmentally. So stop judging yourself. That's the most important thing, is to stop judging yourself.
Yeah.
And then it's just, yeah, and then it all falls out from there.
Thank you. So another question here. I'm suffering from anxiety and fear, like I'm feeling nervous all the time. It's like butterflies in the stomach all the time. Things such as talking to people, answering, making phone calls, chores at home, making, etc. all makes me nervous. Can mindfulness help, or do I need to consult a psychiatrist?
Yep. So definitely, yes, mindfulness can always help, but psychiatrists are good too, or a psychologist, someone who, like a talk therapist. Um, and so I know sometimes there's people who have this about going to psychologists and mental health professionals and taking medications. It's like, oh, like somehow it's a failure. And I know there are some meditation teachers who have that attitude, like, oh, if you're meditating enough, you don't need medications. And I don't believe that. Like I said, I know people have been meditating really hard for 10 years and they still need medication. So, everyone is different. And so, so I'd say, definitely try the mindfulness. I think medication and mindfulness work through different routes in the brain, and so they work synergistically. So it doesn't, definitely not either or. I think that, both can help, and they do work in different ways. So I say try the mindfulness, and if that's not doing enough for you, stick with the mindfulness, but then maybe add some medications as well, or talk therapy. I'm a big proponent of talk therapy. So.
Thank you. Another question is, I have frontline medical worker in my family. What can I say to help reduce the anxiety?
Yeah, that's a hard one. Well, I think it's important to know what they're anxious about. Are they anxious about getting in themselves? Are they anxious about spreading it to others? Or they're doing it right. I mean, so I think, just listening is, that's basically how talk therapy works. It's just deeply listening without trying to jump in, without judging them. And so being that for that person, you're just saying, hey, tell me what's going on for you, and just listen to what they have to say. And then, and not trying to fix it, just letting them tell their truth. And that can be a huge, huge, huge relief for people, is just being able to say it and to name it, and to really help them understand it in a really deep way.
Yeah. And sometimes by not giving advice is more helpful, because we don't really understand their situation and what they're going through. But as you said, just listening allows them to just put it out there, and it relieves them.
Yeah.
Thank you. Another question here is, thanks for the insightful session, Sara. I personally find it extremely difficult to practice mindfulness or meditation at work when I'm feeling anxious or sad. As a junior employee, how do I try to encourage this at the workplace?
Yeah. So for themselves or for other people? I guess that's, we don't know if it's for themselves or for other people.
I think for herself as well as, her colleagues, I think, at the workplace.
So I think the best way is to be a role model. That's what I've heard from so many people, is that people, if you're really practicing and your behavior changes because of it, people will notice, and they're like, whoa, what's going on? And, then they'll just see, wow, she started practicing mindfulness and it really had an impact on her. And so then that sort of plants the seed that, oh, maybe I could, also, because I know, for me, like, I always thought yoga meditation was silly, but then my boss he was a long-term meditation practitioner, and just the fact that he did it sort of normalized it for me. And so I think, and I hear that a lot from people. It's like, oh, this person who I know, that makes it, it's more real then. It's like, oh, okay, and this person's not a hippie, and this person's not strange. They're just a normal person. And, they're not talking about crystals and magic, and, they're just acting normally. And so it's like, okay, it's just familiarity. So I think that's probably one of the best ways you can do it, is just to talk about it in really normal, simple ways, so they understand it. Mm-hmm. And then to really live it yourself. Yeah. And then, like I said, in terms of bringing it there, just really trying to be as non-reactive as you can. And, if there's things that trigger you, really trying to practice them at home where it's safe. So if there's that one person who always drives you nuts, just, okay, that person's going to say that thing to me. If you do the metta phrase, that's huge for me. When there's people who are driving me nuts, I do metta phrases for them. And just, may that person be happy, may they be healthy, may they be safe, may they live with ease. And I just do it over and over and over and again for 5-10 minutes. And it completely changes my relationship with them. And they'll notice that. They'll totally notice that. So yeah, good question.
Thank you. So I would like to propose that we end with a short practice. So if there are any words that you'd like to close with before I lead the practice?
No, thank you. This was really wonderful. And I'm so happy that so many people showed up.
Yeah, at the peak, it was like 310 people.
Wow, that's really great. And just, this is a testament to your teaching ability, Angie. So thank you for having such enthusiastic people.
Thank you for doing this. I know it's coming to 11:30 p.m., probably past or close to your bedtime.
Yes, I'm going to bed. Cool. All right.
So
So
now I'd just like to invite everyone to place your hand on whichever part of your body that you feel the butterflies or the tension or tightness. It could be on your chest, or it could be on your stomach, or even on your shoulder or the back. This is just making both a body connection and then a mental connection as we close our eyes after placing the hand on the part of the body that you feel the tightness or tension or any discomfort or pain. And just start with 3 beautiful deep breaths. And now just let your body breathe naturally and allow you to just sense where your hand is. And just direct your breath with kindness to the space where your hand is placed. And putting all judgments aside, and just do it with great care and kindness for yourself. Accepting that you are not perfect, that you're only full of strengths and talents with no weaknesses. That's just not going to be the case. So you are good enough as you are in this present moment, accepting yourself as you are, and just breathing kindness into you. So in this self-compassion practice, to give yourself unconditional love, love that has no judgment conditions attached. And be inspired by nature. It gives oxygen to everyone. It doesn't discriminate. It gives sunshine to everyone. Offers water to everyone. It doesn't judge. So breathe in the oxygen without judgment. Giving yourself kindness, compassion, love, without judgment. And just direct that breath filled with unconditional love and kindness into that space where your hand is placed. And use the metta phrase that Sara mentioned earlier on. May I be well and happy. And just repeat that in your mind. May I be well and happy. And just repeat that another 3 times and slowly opening your eyes. Thank you. I hope that gives you a little bit of relief to any anxiety that you may be feeling. Please go to Brahm Center website for many of the audio tracks are offered for free, including the practice on loving kindness, which would be very potentially very useful to you. So I look forward to you joining our Mindfulness at Sunset sessions that we're conducting every day during the weekdays, and also to check out our mindfulness courses that are being offered. So with that, Thank you once again, Sarah, and thank you for sitting at the door. As you can see, there's a doorknob on top of Sarah's head because that is the brightest spot in her apartment. So she's been sitting there cross-legged, serving all of us, and just really, really, really grateful. Thank you, Sarah. May you be well and happy, and may everyone on this webinar be well and happy. Have a great day. Thank you. Bye.